list, and thank you, Poor Memea, Talafalava. We're trying to connect with the rest of the Zoomers that they trying having a little technical difficulties coming in. But anyway, we're going to start because I know your time is valuable. Thank you for the King County Public Health staff. We're joining today with our guest, uh, Pua Memea. Pua works at the Department of Public Health as a community health worker, assisting clients who have tested positive for COVID and help people to sign up, for groceries, household assistance, and connecting them to other resources. Chris Johnson, hello, Chris. Chris is a social research scientist and a manager for the public health. We want to adopt you, to be an island at a time. Seattle King County Care Coordination Team that links people in isolation and quarantine with resources and services. And again, welcome to our special guest. Every week, she provides a lot of resourceful information and very relevant, very, very helpful, and make a difference in the Pacific Islanders' life. Christina Predict has a master's in public health and epidemiology and is the Public Health Information Officer for Public Health Seattle and King County, and also focused on the COVID-19. Thank you all, and it's a great pleasure, to have you all. Hopefully, that Sadie is having a difficult time trying to log in. But I have a question. There has been a lot of information in the news about the Delta variant and rising COVID-19 cases in the King County. Can you provide an update for the listeners? Thank you.
Hi, Sylvia. Thank you so much for having us. We're really happy to be here and we enjoy this opportunity. So thank you so much.
You're welcome.
Thank you for your question. That's very relevant right now. So in King County, we have been seeing increased cases of COVID-19. Cases are significantly down from the peak in December, and we know that is because of vaccination and people taking precautions. But since the mask mandate lifted on June 29th in King County, we have seen a 130% increase in COVID-19 cases. And this is really concerning. And it is likely due to the Delta variant that you mentioned. So the Delta variant is a dominant strain in King County, and we know that it makes up the majority of cases. So if you are exposed to COVID-19 in King County, you are likely exposed to the Delta variant. And this is concerning because the Delta variant is more contagious, and the time period when the person is contagious is longer. So we really want to make sure that we mitigate the spread of COVID-19. Masks are an excellent way to do this. Vaccine is the best way to do this. We know that the vaccine protects against COVID, provides very high protection against COVID-19 and variants. So we are seeing a rise, but there are things that we can do about it. So getting vaccinated is one part, also wearing masks. King County recommends that all people wear masks indoors to help with this rise in COVID-19 and to stop the spread, including of the Delta variant.
So much, I heard it on the radio a couple of days ago and even yesterday that Governor Jay Inslee saying, the rising of the Delta variant. And there is a concern, he also said something that maybe most likely if it's going to keep growing, is there like what your projected, for the upcoming month is, are we going to go back to the phase one, like how we do everybody back to the restriction of the social distancing and also wearing masks?
Yes, on wearing masks, especially in indoor public spaces for every person. In terms of phase one, when things were severely locked down, when some businesses were forced to close and other businesses were at low capacity. That is not what we're looking at right now. So things will remain open at this point with the recommendation that everybody wears a mask indoors, whether they are vaccinated or unvaccinated. And this will be incredibly useful for stopping the spread and getting to the point where another lockdown, phase one, as you mentioned, something of that sort is not needed. And I think it's really important to remember that hospitalizations play a huge role in this. And there has also been an increase in hospitalizations. And oftentimes, as cases rise, it's a couple weeks before we see the hospitalizations rise. And that's when it gets dangerous because we may not have enough hospital beds for people who are sick. There may not be enough supplies. So that's one of the main things we're looking at. So that's why it's important to get vaccinated if you are eligible, to wear a mask when you're indoors, and to practice social distancing when you're indoor in crowded spaces to help stop the spread and prevent us from going down back to phase one.
Thank you so much, Christina. I have quite a few of our panelists. They were supposed to join us, and they're having that little technical difficulties. Joining us. We don't know what's going on because it looks like we're on streaming live right now. But you can always welcome to call at 206-651-7552. We're trying to do our best, but because we do know that these are very great information, and also the staff from the King County. I have this text here from this one person that heard Pua. Pua in our tongue language is like gardenia. Pua, I have this one person, he was supposed to come in and say the opening prayer. Pastor Noah was asking, what kind of household assistance are you providing to the community, to the King County community?
Thank you for the question. It's with the name of the program is called Household Assistance Request, and it's basically tailored to help clients that have tested positive for COVID. So it's a one-time payment assistance that helps pay for rent, mortgage, also household bills. So when we say household bills, we're talking about like phone, electricity, water, utilities, electric, gas, but they have to be current. That's one of the things. And we pay a maximum of up to $1,500.
I see. Okay. Thank you. And
Can I add? There's also grocery assistance.
right.
We can, so for people who need help in order to be able to quarantine or isolate, we can provide immediate assistance, the bill assistance that Pua Mamea described. We can also provide some grocery assistance, and we can also help people make sure that they are linked to longer term services that go beyond the isolation and quarantine period. And that includes all types: legal assistance, housing assistance, healthcare, and unemployment, as well as basic food assistance and utility help.
Okay, that's wonderful. In that case, is there anything that we can maybe set up like an event or something, or it's just like everything has to be done online? So that way we can, like do the food assistance, like to fill out the application, or we can be able to help out, with our community, not only with the broadcast, but also, the outreach, for our community.
Yeah, no, that's a great question. Thank you. There's a number of ways. We know that not everyone in King County has internet access. And you
Right.
are right. Some of the assistance, like if we're filing for unemployment, they very much, it's easier if you do it on the internet. They say that the wait is not as long. You can get unemployment, for example, via a phone call, but you'll be waiting longer. If people want assistance, they can connect with care coordination, and we can help people walk through the application stage and help answer questions and just provide some support while you're fulfilling some of these applications. People can also do it by phone. I think you can also get internet access through the library, and we could have events. You are right, at some of these vaccination events, we could think about how to link people and make sure they know who to call to get resources.
Exactly.
There's also, for people who want assistance beyond isolation and quarantine, if you want assistance but have not been exposed to COVID or not positive, there are outreach events held by the Chapline and Access and Outreach. And so they also do some of the things that we talked about and connect people with longer term assistance. And you are right, they often are present at events. And so people should look for those tables.
Yeah, because like our broadcast today, it's for our Pacific Islanders, and like an outreach event, that will be like focusing, on the Pacific Islanders, for them to come and get the resourceful information or any household assistance. But we can maybe look in it, and I'll connect with Christina Predict, how maybe we can set up, something for before the fall coming, some kind of outreach event for our Pacific Islanders. Is that something that approachable, or something that we can talk about it in the future, or it's just something to, for you to maybe see if that's, approachable, or it's applicable, to your program and the assistance that you provide to the community. And you can feel free to let us know.
I'll follow up with you, Sylvia, early next week.
Sure, no problem at all. Okay, and the next question, what is the best way for people to protect themselves, especially what if someone do if they learn they have been exposed to the COVID-19?
I'm going to start with exposure to COVID-19 testing. Testing is very important, especially with rising numbers. So if you learn you have been exposed to COVID-19, that somebody in your immediate community has a positive test, or if you have symptoms such as losing taste and smell, unusually high levels of fatigue, a cough, a fever, you should be tested. And it's important to get tested, one, so you know for yourself, two, so you can isolate and quarantine so that you don't spread COVID-19. But also it starts the contact tracing process that I think Chris or Pua can tell you more about.
Christina, thank you. You always provide, like almost like on a weekly basis, even if you're not on live, but you always share the information for us to announce and share with our community, and everyone greatly appreciate it. Okay, the next question is, what if someone tests positive and has to quarantine but will lose income if they do? Is there any help? I think this one here may be even going to the Pua. Or the question again, it's what if someone tests positive and they have to do the quarantine and they will end up losing income. If they do, is there any help assistance?
Yes, there is. First things first, if you do test positive, I sometimes tell my clients it's always good to reach out to your provider or whoever told you that you tested positive just to let them know what's going on and ask questions. There's also the COVID response, and there's also 211 that they can reach out to. Also, I do think that it's important that once you've tested positive, don't panic. Just assess your situation. Pretty much, how's everything looking at home? Like, it's normal to think, well, you're going to have to isolate. You can't go out in public. But then you can think, well, do I need groceries? What are some essentials that I really need while I'm in isolation? And you can reach out to our COVID response team. I don't remember their number by heart, but I'm sure Chris will also add in later on. And if you do end up losing employment, like your job, we can always help you with connecting you to the right program or help you file for unemployment. There's also FMLA that we normally provide a lot of information to clients. And Chris, what do you think, Chris? Is there anything you'd like to add?
Yes, thank you. I think the biggest thing, oh, sorry, there's someone walking by the house. Hopefully you do not hear the dogs. I think if you need to quarantine because you've been exposed or been positive and you're worried about losing income, I think the thing to do is answer the call from contact tracing that Christina mentioned, and we can explain contact tracing if that would be helpful, because they can link you to resources. And I think the most immediate resources that we can do to try and reduce the loss is the grocery help and then the bill assistance program, the household bill assistance that Pua mentioned earlier. That is meant to offset the loss of income and enable people to stay home in quarantine. That is better for their health because you all will get the rest you need. It also helps prevent community spread. So it's good for our communities and good for individuals to be able to quarantine or isolate. And so the groceries and the emergency bill assistance that covers current bills. And then we can also link people to longer term services to make sure that they're getting all of the resources we can possibly get. And there are resources regardless of citizenship. And then if people have questions, we talked about a phone number, and I'll put it in the chat after, but if you don't want to wait for Public Health or Washington Health to call you, you can call them at 206-263-8480. Again, that's 206-263-8480 or 206-477-4992. And I'll put those in the chat. And then I just want to mention, there's a website. If you Google King County /next steps, that will literally walk you through, I've now tested positive. What do I do? What do I need to know?
And I just want to emphasize on what Chris says, that contact tracing, one, it's a very important tool for stopping the spread of COVID-19. So it helps somebody know right away if they've been exposed, and they can then take the steps so they don't expose others. But within King County, it's also a really essential step to start services. Somebody will call you, and picking up that call is so important, because not only will they do contact tracing in your community, but they will also take the steps to help connect you to these services.
Thank you for adding that.
Yeah.
Thank you.
And just one more thing about contact tracing is you may be, if you test positive, you will be called by a contact tracer. But also if somebody you have been around tests positive, you may be contacted by a contact tracer. So it can happen in different ways, but they are there to really help the community and to help you.
Wonderful. Thank you so much. That would be very, very helpful. And I know all of these, makes a difference, because there's a lot of people having a lot of the technical difficulties, or they don't really know how to access, all the resourceful information. but also the putting out the phone number I shared with the community, and they're very very happy. And I have about like 5 families a couple weeks ago. They said that they are also having the rental assistance, and they were able to get like um, the food benefit temporary. I think from that event that was at the Foster High School 2 weeks ago. And thank you so much, Christina, for forwarding that thing that was at the stadium at the Foster High School. And it's just more like very centralized, for our Pacific Islanders in Tukwila on 144th. And so they were able to get back to me and just saying, thank you so much. Without this, we won't be able. But they were able to go in and talk to them in person and getting all the assistance that they need, And so I'm very happy to see some of the people, get the assistance, because of the referral information that you all provided. Okay. Yeah. I have Hokulani on. And Pastor Noah. Pastor Noah? Okay, and I have Saini now. They're able to come in. Saini is a retired person from the city of Seattle, and Pastor Noah working with the Nigeria community, and he's also serving a lot of group homes. And Hokulani is currently an employee for the city of Seattle. So, Saini, maybe I'll give you this opportunity. If you have anything, any thoughts to share, it's either you. And Pastor Noah, please, can you come in, show up, join us with the video so we can see you. And also Hokulani.
Yeah, I will be on the audio. I have other things. I'm working on my office right now, so sorry about that.
That's okay. Yeah, Pastor Noah, go ahead.
Yes, I thank you so much for referencing the very important questions that are challenging the time, especially with the COVID-19.
Right.
There has been conflicting informations. You don't know which one to follow. You don't know.
Exactly.
And then if I will interject, they have been a kind of talking about the booster shot. Is there a situation that it will come, those who already been vaccinated? Well, what actually is the booster shot, and then what is the timeline or something that we need to know about?
Thank you, Pastor Noah. That's a great question. And you're right, that has been in the news a lot lately, especially a couple of weeks ago when the CDC and the FDA started to explore that. So since the disease is new and the vaccines are new, we don't yet know the duration of the protection. Currently, the vaccines are providing very good protection. It was over a year ago when the first trial started, but there is just what we know historically from vaccines, that protection could wane. And that would mean that you need to go in for a booster shot, which would be an additional dose of the vaccine that you already have. Or if you've had the Johnson & Johnson vaccine, you may opt to get one of the mRNA vaccines. But I think it's important at this time, from the data we have and what we know, all of the vaccines are very effective against COVID-19 and the variants, and there are no booster doses recommended. So what populations people are looking at are people who are immunocompromised, who might not have the full protection of the vaccine. And those are people that would probably be getting the booster first. And that's the population people are concerned about. So I think just to summarize, and I realize it's not a clear answer, right now, no boosters are needed. People are aware that there might come a point where they are needed and they're preparing for that, but that'll be most likely for people who are immunocompromised. And likely boosters for the full population are further off because there is very good protection just from the full series. And while we're on that topic of full series and the booster, I think also making sure that boosters are not needed, but what is very important is that you complete the full series of the vaccine. For example, some evidence for the Delta variant shows that one dose of the vaccine provides 30% protection, and 2 doses provide approximately 88% protection. So that just shows the significance of completing your series. So if you've had one vaccine, please go back and complete your series and have the second vaccine. That's how you're going to have the highest amount of protection.
Thank you so much.
No, thank you. It's a fantastic question.
Okay, Pastor Noah, thank you. I'm glad you have a question. So get your other question, to come up again because our time is limited with them. I'll give this chance here to Hokulani. She texted me some question. Hokulani, could you please unmute your phone and also please join us in asking the question. I know you have great question. Thank you.
Hi, everyone. Thank you for this opportunity to ask the question. One of my question is, what is someone has already tested positive before and received help before and now tested positive again? Is there any help available to the assistance?
There is help available with our program as well. The only thing so let me clarify this first. So are you asking if they receive benefits from the household assistance request and then tested positive again?
I apologize. I'm not sure how, for what I'm going off of one of my family members that was tested positive last year. I'm not sure which assistance program that they helped. So I don't know if it was your program. I don't know how many programs are there, but I'm just asking, since they were positive last year and they got tested positive again.
Right.
Is there a different I can't say if it was your program.
Well, and maybe I can help out. I actually think it doesn't matter, but this is a recent change. So the bill assistance program is actually funded in part by the state and the federal government. Both parties, we now understand that there are these second outbreaks in a household. And so the groceries and bill assistance that Pua mentioned earlier, we can offer those again if a household is experiencing a second outbreak. We do hope, we know it's a second outbreak if there's been 3 months or more apart, but you should always try and ask. Answer the call from public health and ask about it, because there are lots of cases in which we can make exceptions.
Thank you for that. And then the next question I just have with the same scenario, what is the recent COVID-19 testing? Does it has to be most recent, like this month, last month, or the last 90 days? What is the cutoff or deadline?
Well, there's 2 types of assistance. So the groceries and the bill assistance are to help people isolate and quarantine. And so the testing, we need to hear from you within a few days. So once you get a test and it's positive, there is some immediate assistance to enable people to isolate and quarantine to protect their health and community health. The other types of assistance I mentioned that you can get through the CHAP line and through Access and Outreach, you can get that assistance anytime. DCHS, the Department of Community Health, has a rental assistance program right now. There is open enrollment for health insurance. So all other types of insurance, unemployment, basic food assistance, you can get that at any time. And there's lots of ways to connect, and we can go through those phone numbers again if it's helpful. And for those of you that are watching the broadcast, they've been in the chat, but we can go over those if that would be helpful. So again, the immediate assistance to help people isolate and quarantine, that we need to hear and talk with you as soon as we can after that test.
Thank you so much for your time. Thank
They were
you.
great questions. Thank you.
Okay, I would like to, to warm this up, have a little nice melodious song, from the South Seas, a little nice breezing from the islands, by playing one of the song here is the best song right there. Yeah, we'll have this song here, just to have a little cool breeze, for 1 minute, and then we'll continue on, and Saini will be next. And also I have our community leader too. Sina is joining us too. Hello, Saini. Saini, what will be your question? We're gonna go to you this time.
Yes, I'm curious about any updates on vaccination for kids, for younger kids now. What is the update on that, or any projection?
I think you're muted, Christina. I do it all the time.
Thank you, Chris. You think I would have learned at this point how to use Zoom. But yes, so thank you. Children 12 and over right now are eligible for the Pfizer vaccine, and trials are happening for children who are younger than 12. There's sometimes in the media you use different projections, you hear different projections such as by the fall or by the end of the year. But the truth is they're monitoring those trials very carefully, and they're moving through it conscientiously. And hopefully it will be soon that more children are eligible, because they are unprotected younger children right now. But there aren't any projections or firm dates about when children younger than 12 will be eligible for the vaccine. But
right.
People are working on it.
Yes. Thank you. Just curious if there's anything.
Yeah.
Next here that's coming. For you, Pua, since you have all the other resources that are long term, could you please tell us what are some of the other resources other than the groceries and the household assistance that we may need to be aware of? Thank you.
Yes, thank you for that. There is the eviction program, eviction prevention, rental assistance program that's also out there that families can apply. That's especially if you have like any debt or actually back rent that you need to catch up with, current ones, or if you even lost your job, you can still submit an application online.
Right.
There's also a multi-service center. It just depends. You have to go on the website, and I will drop the website in the chat. So normally when people do call for that, it's good to just be specific and say, hey, look, I'm not looking for a one-time assistance. I am interested in the long-term program. And so what we do is we'll research for you which program, as long as you let us know what your situation is. If it can be discounted utilities, it can be like finding a place, low-income housing, that stuff. So there are a lot of programs out there. But the one that comes to mind right now is the eviction prevention. And I'm pretty sure that's also short term. There's also thank you, Christina, the CHAP line that my colleague dropped in there. That's the other place that you can call and just kind of get more information also. And that is a good question. We are working on, it's almost like a flyer that we have all these resources that we can maybe drop it in the email, however we respond or communicate with one another. So there are lots of programs out there. Let's see. It's not coming to mind right now, but
I can.
so yeah.
Let
Is
me
there
help
a
fill in.
phone-
I
is
think
there
it
a
was
phone
great to
number
hear you
that-
talk about the rental assistance program.
Yeah.
I think the rental assistance, and Pua mentioned healthcare. I think the other ones I would want people to know about: unemployment. There's basic food assistance, which provides some support for food for a long time. There's also, you can get help with an Orca Lyft card if there's transportation issues. So there's some transportation help available. There's also free legal services if you're having trouble with a landlord or want some legal advice or want some advice about an employment situation. So those are some other types of help that are easily available.
Is there a phone number, a direct phone number that we can call for assistance? Like some people having difficulties with technical difficulties. Is there a phone number that they can call to make an appointment or have a place to go to? Like that's what I was just asking earlier, but Christina will reach out to see maybe we can set up an event, so that, and we can provide, information. But in the meantime, if people are asking, is there a phone number that we can provide to give them? Or we can just provide them
What
the
do you
phone
think,
number?
Pua? We could give it, I think the CHAP line
Yeah.
is a good place to
Chat
start.
line? Okay, absolutely.
Yeah, CHAP line. That's right.
And that
Okay.
is 1-800-756-5437. So again, the CHAP line is a good place. They can help with Orca Lyft cards, health insurance, and then link you to some other places. And that's 1-800-756-5437.
Okay.
I think the other place that can link you to housing resources and all other types of help, mental health resources, is the 211 line that Pua Mamea mentioned earlier.
Yes.
Thank
Kristen
you so
Pua,
much.
is the Federal Way Health Center a resource that people could use? It is available right now?
I'm not sure what you're referring to.
Yeah.
Do you know
Oh.
of something?
The Federal Way Public Health Center. I've heard it talked about as a storefront where people can go in and receive assistance in person if needed.
I'm so glad you're here to mention it then.
Yeah.
Let
guess we'll
me
have
put
to-
it in the chat box. And this is a location in Federal Way, 33431 13th Place South. And the phone number is 206-477-68 And they provide some of these longer term, they provide information about some of these longer term services and if people are eligible. And also the Orca Lift cards that Chris was talking about.
What is the name of the center in Federal Way? It's Federal Way.
Federal Way Public Health Center.
Oh, Public Health Center. All right.
And I
Great.
just put the address and the website in the chat box. And I'll
Okay.
also drop in the phone number.
Thank you so much. Thank you. These are very okay. I hope everybody like Pastor Noah, Sina, and every single one like Saini, Hokulani, you can write it down to, Federal Way Public Health Center. And, it's easy just to Google it, and you can go directly to that, or you can use the phone number 206-477-6800. Okay.
And they're open Monday through Friday from 8 a.m. to 5 p.m.
8 a.m. to 5 p.m. from Monday through Friday, yeah? Okay. In the meantime, we have one of our community leader. Her name is Sina Aloitafuna Tuivai Pecker. She always joins us, on our King County, communication, on a weekly basis before. But I know maybe Sina will have something, because he worked with the senior community, the First Tongan senior community of Seattle. And I know that looks like we're all in the same beach. Sina has the coconut, and I think we'll also recruit Chris Johnson to be on the beach also with us. Also, and then so we, I think Chris, enjoyed, the islands breezing, yeah? Okay. Sina, go ahead, and I know you have a lot of questions, all the time because you care about how to provide on a weekly basis what's make it safe and what's best to help them, with a lot of their needs and assistance. Sina, can you unmute your laptop or your phone?
Hello.
Yeah.
Pua Batu, I know your grandpa. I said, Paul Batu, your grandpa, sweet, sweet man. I know him since 1980, sweet, sweet man. And I also know your grandma very well, sweet, sweet lady. Christina and Chris, I have a quick question. Can you explain what's the difference between OCA Lift and OCA Card? We as volunteers, we're thinking of opening next week for a senior program. And I like to, this is one of the main things that I talk about is current event. And I don't want to, they're already scared. And I don't want, the last thing I want is talk about more pressuring them about COVID-19. But I want to also talk to them about something that's good for mental health. So please explain the difference between OCA Card and OCA Lift. OCA Lift, yeah, because I'm in the process of helping our seniors get those cards. They love to go out now, and those are some of the things that I would like to discuss with them in getting, because we are underserved program. And I know there's a lot of resources out there for them. And that's what we're doing as a volunteers, is to seek out for something to make their daily life, better, lively, happy, because they are the most vulnerable, and then they get lonely easily. And what we are doing as volunteers for our Tongan community is to make them happy, talk about happy stuff, introduce to them great resources that kind of give them the lively side of them, So that's one main thing that I want to ask you, so I can explain to them the difference between OCA Lift and OCA Card. Thank you.
I saw, no, thank you. Thank you for volunteering and doing that work and connecting people to the resources. I'm so glad you're doing that. Thank you. I think you asked about the difference between Orca Lift and an Orca Lift card. I think it is all the same package. The formal name, and Christina, thank you for putting in the link, and please feel free to add. It is an Orca Lift card. Orca Lift is the service, and the card just enables the service. And so once you have the card, you can use the Orca Lift services, the transportation services. And I believe it's the buses and then some ferries, the local ferries, like the ferry to Vashon Island.
So
Yeah.
if I have to ask for Orca card, so that way they can use for a day trip, ferry ride. They love, that's one, 90% of my seniors would like to go out on a ferry ride as a group. So I just want to make sure that I know what to ask for, the type of card. So it'll be Orca card. They probably don't need Lyft because all of us, majority of the drivers are volunteers. And then due to a language barrier, they're more comfortable having us volunteer who speak 2 languages, 3 languages to take them out on the outing.
That's fantastic. The same number, the CHAP line, 1-800-756-5437, can provide information about the Orca and the Orca Lift program. And they could answer specifically about different types of transportation and also what it means for seniors. If a senior citizen is using the transportation, there may be different fares available as well.
Thank you.
I wondered if I could mention too, you mentioned that you wanted to support mental health. So there's another service that came about using some of the federal funds, which is called Washington Listens. And it's basically a line. If someone is having a rough day, they can call Washington Listens and talk to someone. It is not right. It is meant to be the gap between someone who wants ongoing mental health services and someone who wants not much at all, right? So it is just to support people during these hard times, because so many of us, you're right, it is a lonely time. And one way of talking, even if you want to talk about something positive or something stressful, I think Washington Listens is a great option.
Would they have interpreters for to help them?
They do.
If they have a particular topic that they would like to. One thing about my seniors, I would say our seniors, Tongan seniors, they're very secrecy about their feelings. So you ask the right question, then you're inviting them to give you more detail of what they're worried about or what they're trying to share. That's the differential of our cultures. They're very secrecy about their feelings. We have to go in a positive way for them to share their mental, if they have any mental issues to share. And you have to become their best friend and then introduce the right topic. I use it a lot in our senior program where we share. I have time that I do a sharing time and only talk about current events. But right now, there's only one topic: is COVID, and that's our job as volunteers is to lure them into a more like a happier current event style. If the mentality is not positive, it's hard for us to introduce anything else. So that's I think that's the trial part of being a volunteer to our elderly and underserved elderly in our community, especially I'm speaking for Tongans and other neighboring Pacific Islanders.
Well, thank you.
I also want to point out for anybody younger who's listening, the number that Pua put in the chat box for Washington Listens, 1-833-681-0211. That is also a number that you can text. So if you feel like you really need to reach out, or you need to talk about something, or you're having feelings that aren't familiar, that is a number you can text as well as call.
Can you repeat the number, please?
Yes, it is 1-833-681-0211.
Thank you.
Thank you, Pua, for putting that in.
You're welcome.
Okay, thank you. Yeah. Also, thank you, Christina. We have the good news, that we were setting up to do an electronic, like virtual training, and find out, there was only like 1 or 2% were able to do the technical, like a lot of the things that was required, but it's for the mental health first aid training. And so we will be able to do that like in September, as I was told, but we're working on the location and the time and the date. And I also need to hear from you too, Christina, but thank you for your support. And I noticed that a lot of our people very much needed that. It's a big support. I think when we find out, when we did the something, it's called pre-work, we found out there's a lot of things like about self-care, how to take care of yourself, that is very much needed. It's almost like a biblical thing. How can you go take care of other people when you don't know how to when you don't have time to take care of yourself too? That is like, and we love that too, because we live as a communal, just like what Sina does, we take care of each other. We help our elderly. We don't put our elderly in a nursing home. We take care of them at home. And that's just like almost like a culture thing, But thank you again. And then I have a question here that someone was texting me for Pua. But Pua, I'm glad that Sina mentioned that Paul Paju is a legendary in our community. He was known as Von Paul Patu, a longtime advocate, dies at 70 years old. And he always tried to help all our students, including my kids, 2 of my kids, like when they're neglecting, to finish their high school homework and stuff like that.
Right.
He was able to come forward and try to put in some time. And he didn't have the words, never say no. He'll always make some time, and help hundreds of our Pacific Islander students to graduate and return to school. And they are very successful nowadays because of your grandpa, Paul Patu. And we do miss him. He does help out, like Saini, that feeds the friendly islands of Tonga. Paul Patu was the one, the pioneer to also help creating all those community outreach programs, for our community and the seniors. And we will never forget that. He left a lot of great legacy in our community.
Oh, thank you, Saini.
Back to my question here that someone was just texting me, asking, about the groceries. If I don't really have any legal paper to live in this country, but I got locked down since I came here in March of 2020 of last year, is there anything that will help me with the groceries or any assistance, or I have to have any legal paper to prove that I am a permanent resident in this country or a citizen?
From what I know is and I'm sorry that you got locked down or are stuck here in Washington. There is support. There is a lot of help out there. You don't need to be a citizen or a citizen of the United States to qualify for the grocery program. You would give us your information, and also Chris can add in after me And the only thing that we would need is just your address and that you tested positive. And there are other programs out there too that can help. And again, Chris mentioned earlier about like legal services um, that very experienced supporters or workers can help, get your documents or refer you to other programs. But nothing comes to mind, only because I want to let everyone know that I'm still new here and I'm still learning a lot of the resources. And Chris has been a wonderful trainer for me. So yeah, there is help. There's absolutely a lot of help here in King County. If you don't have any legal documents or if you're not a resident here, I would also, again, there's a 211 that you can call and, be honest with it. Well, you can just let them know what's going on, explain your situation. And they're highly trained to refer you to get you connected to the right people, the right programs. So
I think
yeah.
Pua is right, and you're wonderful, Pua, and it's great to learn more about your family. I think if you're in lockdown and needing food services and no longer quarantining or isolating, the basic food assistance is a program that requires citizenship, but sometimes children are eligible, even though the parents are not. And so it's always worth exploring, especially if you have children. They are eligible for basic food assistance. There are also food banks, and there's a map of food banks that we can help. So I think calling one of the lines and asking people to help, especially if you don't have internet access, because Pua is right. There are local community sources of foods and community-based organizations. For example, I know of 2 organizations that will connect people to culturally relevant foods, because the food banks, in some areas speak to a general audience. So again, I think calling the CHAP line or reaching out and asking for help, because there are definitely resources. There's also healthcare services for people who that no documentation is required. So I think King County, we're very lucky to be in a county that is committed to equity and serving everybody. And so we need to talk about where you live and help you find those resources available. So it's definitely, as Pua said, worth calling.
Thank you so much, Chris. For those of you that are listening, this is Chris Johnson. Thank you so much, Chris. Absolutely right. Every now and then I have some people from out of town, and they said, you have the best county ever. We don't have all those services that are provided here in our area. We only have most likely like from the federal government, but we're very fortunate and we're very blessed that we live here in the King County, and we are being treated like a king right here in the King County. Maybe that's why we call it King County, eh? Yeah. With all the resourceful information, with the equity, equality of all, and we do appreciate that. We're so grateful and we're so happy, to live in a community, in a state that, humanity services is very, very much number one thing, for them to care for each other and take care of respect, the human services. Thank you. Okay, I noticed that we still have Noah. Yeah. Noah, I'll give you this last question because they have to sign off right now because of their time. We do appreciate, because they're only supposed to stay for 1 hour. We were late because we were trying to connect all the platform. But Noah, Pastor Noah, are you listening? Pastor Noah, I'm giving you this last opportunity because they're waiting, because it's their time. They need to sign off because they're going over the board with our coconut time. Maybe he's not listening.
Can I raise my question? Can I have a quick question?
Okay,
comment?
sure. Go ahead.
unless Noah happen. I have just to add on to that one question about if someone feel like they needed help, food, because you have to, there's every culture have a community. Like for us Tongan, we have a Tongan community, senior community, and we do have food bank, we have programs, we have connection. I'm sure that as PICA is also a great organization that any islanders can go there for help, because you have to belong to a community or organization, because we have connection with King County, City of Seattle, immigrations, and any other programs that can help you being in islanders who feel like they're hungry, feel like they need assistance with where, you have to try to connect with a community of your culture. That's one advice I think it might help if any islanders who need access to resources, food, medical, try to connect with community. There is a title, every culture have a title community. They can also go there for help. First Tongan Senior Program, we are, an organization that can help. We have access to vaccination, immigration, or, food banks. We'll be able to assist you in those parts, if they need assistance. Thank you.
Thank you for your work. Before we sign off, I'm just putting in the chat box one last event. At the Renton Bible Church on July 31st, there is an enrollment event and health fair. So if you have not received your COVID-19 vaccine, this is a great event you can go to receive the vaccine. There's also other services such as health insurance enrollment. You can do mammograms by appointment and receive information about King County resources.
Thank you so much, Christina. And again, it will be at the Renton Bible Church. It's on July 31st, which is this coming Saturday. And they have a lot of program there that also very much needed with our community. And I'll make sure that I will post it again. But we did announce it, on our last program. July 31st, Renton Bible Church. And I just happened to see that like 2 days ago.
Do you mind if I add one more thing? Christina jogged my memory. I also know at the start of the hour, and it's been lovely to visit with you all, at the start of the hour, Christina was emphasizing testing and how important it is for us to know, right? It helps you protect your health. So it's better to know and get tested than not know. The Enumclaw test site, I know it's in South King County and it's not reachable for everyone, but at Enumclaw, we have been distributing boxes of dry food. There are food kits available. And all you have to do is go to the testing site and ask. So that is one place. And we're looking into how to better distribute those so we can reach back out. But I know the Enumclaw testing site has food kits available.
Thank you.
Thank you. Well, I think that we're coming to the conclusion of our having sharing informational resources with all our Pacific Islanders community. We'll make sure that most of the time we print it out and pass it out, because we do want to make sure that all this information are reachable and also spread out with our Pacific Islanders community to make sure that they know how to access and also how to get assisted, when they do need the help that they need it. Thank you again, thank you, Christina. And also Christina Predict, is also working with the public health epidemiology, a public health information officer for the public health. And thank you so much for being patient and all your support that you're sharing with our Pacific Islanders community. Thank you so much, Chris Johnson. She's a social research scientist and a manager. Thank you all, and also for your help with our Seattle King County Care Coordination Team that links to the people that are isolation and need, guaranteeing and other resources and services. Last but not least, thank you, Pua, which is the gardenia in our Tongan. It's a beautiful flower, and it's like a fragrance. Pua Memea Patu, thank you, Pua. She works at the Department of Public Health and also working with signing up people for groceries and household assistance and connecting them to other resources that are long-term. And thank you, everyone, that are joining with us today. Sina Seini, Pastor Noah, and Hokulani, and also Brandon, from the Pikawa. Thank you. I know you were having a hard time trying to connect in, but thank you all. Last but not least, we don't have enough words to say thank you. Malo aupito in our language, and we'll have, the final song to say goodbye to you all. Yeah. So we can dance the evening away. Now, thank you so much.
Amen.
Suiti, itaneti, tapo keruva tate nofo ofu fili. Amusia pesi makina, oku nebu bulu, manesi ofia, kafonga ofasi okupa fa'ama.
Thank you all. Bye.
Have a good one.
Business here for about the next half hour. Now is our next one. I'd like to introduce Sunia Laudile. Sunia Laudile is a nutritionist, and we always love to hear the healthy and what helps us, to be healthier and how to take care of our ourselves, especially during this pandemic and all the things, that is very unhealthy, dealing with it on our daily life. Sunia malolele.
Malolele.
Og lava ke ho mai ke click here video, join video. Click here video.
Do I have to click? I don't know how to do that.
Ko sela neta.
Next to the mute button.
Ko next to the mute button o ka reki fo me a ko pe ko
stop video or start.
Stop video or start video. Ko click pe ai. Ko click pe ai ko ene ko asma le vahe ata.
I don't know where it is.
Go now next page here ki mute button. So ke ki mute mute be ho ka te ai ko stop video ko start video. Tonton ke push start video. Go now tu pe lalo pe ho telefoni.
Okay.
Iso kange ko haki video camera. Click pe ai.
I lost everything here. So that's okay. I can you still hear me?
Yes, we can hear you. Ko io maulele stunia ko whaenga mua hao whakamatala ko hae mea ko maho inga taha I ke tokoni ke tau mo uilelei. Ko hangai mea ke tau whai whakaaho. Hange ko mau mea tokoni pe ko whamalo sino pe ko mohe sino ke malo lelei. Ko hangai mea tokoni ko inga lahi au pito whakoutua ko suka ko toto maalunga. Ko kansa ko taiala sisi whawhaua.
O kai ke te aha mea maongongange kana hanga he tua o mai ngowe ke tau hanga toka ngai ngowe. Ko e tau exercise is king and the food that we eat is queen. Ka pau he kai ke te tau hanga o mao ha mea tokoni. Pea koe mea tokoni ko ia koe mea tokoni le rei. Kai ke lava ke tau hanga ke whakamaa e toto. Pe e lava ke to'o ea me he whetu ia mea kai. He kai ke lava ke harness. E to koe mea kai auri a hoko ia koe fat. Koe ngako. Mahu inga ange. Ka pau te kai kovi. Ka pau te kai u kai ke sai e te kai o te kai ngahi mea o ku I kai ke hange ko ni koe. Koe ngahi mea kai o ku unihanga whakamaa e toto. Koe tau kai ke. Ka pahe kai ke maa ho tau toto. O kai ke lava ki hanga he sinoia o to'o ai mahaki. Koe ka pau e maa ho toto. Koe lahi apito ai kalasti na nau hangi ko ni koe kumuhonga I loia. Tama kon ko Armstrong na lova pai ko ni France mana tu fa na tu ni mana na kansa pe exercise pe alwe pe kansa mate pe kansa ko ngai mahai ko nuk tau hangi kansa ko kansa o kai protein yellow protein o hanga e ufi ai kansa o short kai immune system pa mo killer cell o na pepe na tolu ko friendly cell. Peka pa he kai ke lava ke to o ia, kai ke lava he immune system ia o tamate. Peka pa te lava o to o, e hanga pe he immune system o tamate e kansa. O whaingo fua pe no to, ka pa pete ke ngau eke lai a kau I ho kai. Tala mai he toi tapu koe lai a kau koe whai to o ia hio sino. Mohok sino. Peka pau te ke toi hanko e lau a te tapu ta mai ke kai. Ko ho mea kai koe foi a kau. Pea moe nati. Lahe ngahi desina e whai. Ai ange ai whetu na nau kai kakano, na nau inu, ka na nau ngau eki ai niu. Pea I whetu e tahana nau ngau kai kakano, ka na nau hanga ngau eki o lolo oliva.
Olive oil.
Olive oil. Now, ocean koe ai hono CV. Koe kai koe na nau kai koe ni ai ka kano I manu pena na ngā ke niu 3% kansa. Koe ka kai koe na nau kai ka kano pena ngā ke alolo olive 30% koe oil. Ko hona ke he ko lolo niu o I kai ke koe kapate ke hanga o haka pe te hanga whakapaku aki. O kai ke lava ke mafuri niu o kei niu pe. Ko oliva te ke whakapaku, e mafuri le vai a hoko ia koe cholesterol oxidized. O aluia mi hange koe ni koe COVID-19. Minite pe e tahawalu koe lolo koe me mea koe I hototo. Toke time ko ke stress ai, unihanga ia ai o fatu. o ni hanga cause stroke. Ka pate tau mui pe he whamata e ta puku. Mea atama ki anoa, na e kai ki ai ha, ko foi a kau pe me lai a kau. Pena kai ki na mo i ka kai tau hiwanga ni manoa. Peka tau whafo pe ki ai ki hanga ai e tau kai. O sai pe kai he nau o ai anga tau kai. Ka koe whatu tāma ki tau hanga. Koe tau kai pe ki ai ki konga ai. He koe tupunga e maha ki kansa mo suka. Koe foi proclam when we koe IGF-1. Insulin like growth form. Koe mea o tau fie mari ke o le rei ko tau sino e tau kai. Ka koe imposter. O koe mea to tonu ke tau kai. Pe tau ngā ke ngai mea koe o whehala ki. O mutate ai self pe aule vai o suka pe u aro kansa. Ko ki whamatala kona na whamatala mai koe whamatala mau inga ia. Ana ho pehe ki hanga koe ni o yanga kai me whamalo sino. Ko popo ia whamalo sino. Ko pate ose te kai he hoa ko toa pe. Ose te kai he hoa ko toa. Pati ki lue mi tahanima. Ka te lue mi tahanima, pati whoki mai. Ko ne uhinga ngā hero, o koe ai benefiti ia e tahataha, te ni hanga ne o mai ko sino. Uruaki, te ni hanga e ia o to'o e ea, he taimiti ta tangutu hakolo hoto ke te. Hakolo ke te. Ko ea ia, na te kaipa te folo he te hanga e te mea o folo ea. Pako ne alo ea koe ia, ni hanga ea fua whainga tā ia i, a hanga awa koe immune system, e ni hanga harvest koe ai, to'o koe a nutrition me sino. Peka pau, hange pe koe kālolo ka pai ia ha ea i he gas line, he kai ke mo ui kai. Koe u ni hanga ea ia block e ni hanga koe mea. Kai ke te whai ke moe anō tau sino. Peka koe mea kai koe ia e mafuri o alia, o hoko ia alia ke whenga protein, koe ketasol. O alia hoko ia koe alia koe ngako pe alia. Koe protein pe mo ia. Koe protein tae au ngai. Koe negative protein ia. Na e ai ki whamata nau whanau atu he hui na e ai mahe toko taha e ahon. Lau ki e mohe. Koe mohe fu au lahi au pito mohe. Koe mohe o ni hanga ai o whetongi. Pea o ni hanga o ngahi ai growth hormone mo tau sino. Pea replace na hanga whakafonu mai ngahi mea koe ni neo si ngāwai ki he sino. I he te mohe lelei. Pea pate te mohe teka moe mo te kaike te mohe lelei. Pea pate te mohe pe hou e tolu pe wha. Ko te no e konga kotoa. He koe ki a kaike ke lava ke hanga sino o whakafonu ai ngahi ai mea koe nai whi mau e sino. O kou ala tu peha mea whaunga pe kou ole rea whi tuke.
Kai sai apito. Te kore angeni ka sina o kou ilo I foki o mato aki tokanga sina ke mao hangai whakau. Koe whai toko ni aki. Kei ke ngata pe kai ngato ngai community ka koe toko ni aki. Ai hangi koe mea toko ni koe hai funky activity. Ko sina koe takia I he First Tongan Senior Community koe I Setoloni. Te toko ange mo sina kia ha mea o ke whakaukau ke pe ke whehu I ai pe. Aoni koe ngā koe nutritionist koe hana ha mea. E aonga pe koe hangi koe mea kai pe koe hana ha ngai funky mea kai e matu ak toko ni ke whatu preki nai pe na mo I lelei pe koe ha funky activity. Te toko atuia.
Malo apito Fatima kai pehe ke VOSP ko kau ngā tāmaki I he koe kau volunteer pe au o ko ke o sai pe ke whaanga e volunteer he koe kau sewani ti katoa ki ngā awe ke kau tau leka.
Amen.
Pea ko maho inga apito ki au ke nau fia. mo loto lele ko fa pe te hanga pe fa anga e fine eki ko e tala tata ko fine eki u ta valua pe oku ka pau he kai ke loto lele ia he kai ke hua tu ha me e ai e kai pe ia me loto ke kai ai ka ku te ilo lele to ke sai e pa ku mau ka ko mau tol ko ni oku volunteer ke ka tole ke ka ko e mau dietitian oku ha e palan ko ya one whakafuafua mai ai kalasi me akai oku sai ke tole ke ka o ke kapaniu o ke ho akau mo o ngahi me pe oku mahalo ko e peseti si pe ya oku muy ke ai tau kakai ko me pisat lahia oku o ke na sa ena tolo ye me ko mo lele ko ya pa ko palapale ma ka pau he kai ke te akoi pe ko te share ke na wafe mai o kau mo kita ki hono fa o me kai o te pehe o sai kana na tolo ke hule wa kana kai he kai pe ke na kai na tole me kai ko te loto ke na ma i o sai kana tolo o na te na kai pe na tolo ko me ko le te kapani we taha ai kapani ia ua ya to tana ke tu me ai me onesi o te ilo lele pe he ko tau tolo tonga ko te tau kai ko i fo ko mau inga pito ya ko mo lele to ka i mo ka ko mau inga pito ka mau tolu ai ka volunteer ke loto lele mo afe mai ai atamai ai tole ke ka lava hua tu ai fangi me kai no sai na tolu ka ko fia mau pe he ha o fanongo ki he u tokoni mai o ko kawia ke tokoni ka mau tolu ko ni ka volunteer ki no tangai kina mo kau i he mea tokoni o mau ngahi e ko e hot meal ki kau si ke kau tole ke leka tau te kito ke kau tonga malo
Sonia
io koe moni ai me ulau ke ai film ai Sina koe na ki whanga tāma ke whai tau e ua ki he behavior modification therapy ki he kakai vai koe whanga tā koe moni apite lawa sina te whakakore te whakaheke heke ki nau tolu ki hanga e nau ke nau kai koe mea kai ne taha ku nau whanatu nai ngai mai koe hua kau koe hua kau ula hapito e kakai mo lele apito pe over pe foi ma o stroke now lere famalo isino kai ma o stroke ko no hinga harden I blood vessel ko hinga ko calcium too much calcium time he ave really ake ai diamond ke finga ke fra ai block ko ya Whakatu tāmaglahi ai mea pia. O ku iai ka pate mo whakatonga i ka pate mo alu ke angai. Koe lahe e whio hipa moe kauto ke tā loma linda. Paka nau rue koe ke taimu whae koe kai moe mea. Te whakatonga i mau pe he taimu nau eka te pe. Is any dairy product in this? Ka nau pe mawe io whalaka e toke tae mea. Ko hai me whalaga e toke tā ka ki kai e pe e au ia ice cream. Koe ngā ke koe a dairy product o ku osi hono harvest koe ai mea koku ai calcium koku mao me he anau toru. Pea toi o mai me he sino ke whakaosia ngā he koe a dairy product ke tau consume tau tolu. Ai o te more ai calcium o tau sino I he whetu wako e kongoia. Na wiko mea na wino ai hua kau he ku alwake tau e whango fulu ko hili na pape ke mai hua kau pe ice cream e tolu pawe pe ki ai pa mea na usai ai ko banana split ai foi siaine pe ai foi Rocky Road pe ai me Kone momenti peko sio ko kene ilo ko ene kovi. Beto ki mole tu leva me. Ke fai pe ka escribi. E te albe pe te kui mata ta ka ai ti fe escribi. Kai ke o mai escribi he koma ko ia.
Sonia kata ki ko ke hu yana to ta fa no me ko fa matala ko no pe mai. Ka ke pe nai ko ka pa o ko lo tonga tauhi o kai pe mau to le kereka. Ia mau api ko hanai ha o fare ki ha mea e tokoni. Tokoni ki au pe tokoni ki e ko ta wal ngo fulu ko ni ko e tangata e ki nia. Ko hanai ha o tokoni. Ko ha fare I ko nga ke lava o tokoni ai pe ke u lava vahe ko nga ke mo ulelei ko ostokolahi fahinga ta fit ngo fulu ko na os kamata ketu ki na to.
Koe na ia o kia vai o ko ai e au ka te ki whakahato na konga ke ngawe aki koe ki vai koe ku o tika ki haku si au gas ase ai vai koe a hawhitu pea uni hanga e au uni hanga o to'o ai kauti uni hanga to'o e arthritis pea uni tamate ta ai hanga ka pau pe ma a hoku toto te moilere. Ka pau he kai ke ma a hoku toto o pai ke lava ha me o fai te ri hau pe pasa pe ai virus e mo bacteria ai hoksino. Pe ka pau te ai hoksino ke ai mea kai koe ai hoksino. He koe moi koe virus from a bacteria koe nau moui ho tau sino ka pau acid ho tau sino. O kutaha ki taha wha koe neutral corner I 7. Peka pau te ke nofo I he ho siri ho toto ke nofo I he below 7. Teke ki tai teke ki mea. Tau ene ua furu kai ke puke, kai ke tai, kai ke mea. I he seriously going into it. Peka pāte kai o 7.1, koe mahaki, koe wai tau whirea tongo pehe, koe vaihie. Koe vaihie. Ono hinga, koe alki hau wai he taimpuea he karia. Nai koe tala noa pehe. Koe pehe mai te alki hau wai he taimpuea. Koe whainga tae koe alwe pea o mea.
Ka takpe Sonia ko whamatala koe nā. Koe hanai ha mea ka pau te ke lava ki o mai hanga tonu koe nuk toi text mai tō taha koe ni. Koe ne pē mai. Ka pau te ke haka e mai e vai pea winu. Hange pe ko ha whai tō o pe ha mea ke sai hoksino. Kau kai pe e au ia, kai lahi pe au ia, pe au kai e puaka, kai atu moe mea ke, kai ngako, kai mea merie. Koe hae mea au to tonu ke whai. Ka pau ke mau e vai, te sai ke whasisi e ko kai, pe whapotpoto u kai, pe ko kai pāpāhia pe pau ino e vai haka kona o ke whamatala kei. Koe hae mea au to tonu ke whai.
Koe mea ta tau pe ia mo te, koe ohu e liu ka ai hafu fo iawa he waka. O pau pe ke ngoto koe. Pa wow kai ka rocky tap
ko whengai ke sai e te kai pe ko te kai pe te ino e vai
ka pau o te kai pe ka talatu ku kovi ka ton leva ke ai ha puha mate o ke femo ke al ilo pe me go kovi ka ke fai pe ko te ilo pe ko me go kovi pa tu ku leva ka pau te ke alo ke fili ho wa Take koe mea koe teke whai teke alpi ai. Koe teke pau ke au ke. Ka pau teke tauwhi ho mea koe nehanga. O kui ai a whainga protein hui koe fibrins. O koe protein ko tope. Mana tui mau pe ni koe kakanoi manu kai ke mau ai ha mea ia ke ne whakamaho toto. Nothing. O mau ia me lai a kau ka moe fuai a kau.
Lai a kau mo fai a kau,
Koe ki loi po hai mea whakaheka e maka o hou e tahi, la koe maka ki tahi, Ka whakaheka mea ko aonga ke whaia ke whanonga. Nā uheke au ia he, nā ketu au he tae whanima ko hiri. Ketu, authorities he vai, kai ke toi ketu au he taimi. Ko kei kai moa bea mo kai ki mei.
Ai ko tau fianson ya.
Walu ai.
Ka take pe ko ofi tau taimi ko e fitu ni manoa e ni. Toi pe ki minitsi i pe tau whaosi. Ko e kore atu, ko e hana ia whale i ki whewhe ngahi ota i ka. O sai nai o tāke o tau sino pe e ko kau mo ia i ono whakatupo hangai mahaki mo e sit ki o tau sino.
Mana tui mau pe koe toto koe ko uni carrier bacteria.
Iyo.
Peka pāti ke mai hamhaika oku infected ki he mercury o kau he toto koe ake te koe. Koe toto mercury o kau ke sino. Peka mercury uni hao whatupo e kansa. Paka uni hanga o ne cause eia ai mutated ai whetongi ai angai sino. Whatu tāma ke apito. Ka pau ko te taipinga te nau kai kau ane po and how nephew na mai o mai na mai how moi kai pefu for I ka os ka ko I ka tahi ko hapa ni I ka ko hange halu po ko ape hai ka ko funga wa ka ua ko ke ha me ko al ke ha ki ko kaka pe funga ka wa Angre ko misteri ke kakai e nafsio mai ko kaka. Ona ke to. Ko hoksino hange ko 35 years old. O ko lere he o mata he lere tu hoku ru he driveway saki si pa tu ha. O ko ai ma pe he tami mo fitak mo fe tala no mo tamai. Ko ai kana tolu tanga na tolu ka pāte ke whai mea hanga he o tua tala mai ke hanga kai mo ke mui ki ai. E whoki ho sino o ia o toi ki ke hea. Ka pāko lava au ia e konga ko ia, ko hai mea o ke lava. O koe ki non-profit o ko tokoni ke kau vai. Nau tuki hao mo e kau mea na whia mau ai hapa ni wheelchair mo ne. Pau na alo mai wheelchair taha pe mo walker pa te liva era na to ka ko la pena aku ko ka pau ke fe mau no e taimi hanga ngao aki ai 7 principal fruit ai ho smoothie ai kai pa mo sinsa ai kai mo broccoli pe mo le mani ta ia pa pa te ke fai pe ko ia te ke sio ko mo iu ke inu he ta ha he aho ka to fra matawa fai ki atu ha ku to ki hawa mui ke ai tu ke ma ka to ki konga I hanga o smoothie malo apito malo ta mi o fato ka ta ke pe ka pa u ki fe to a fe ala ka pa me da boy
ko fra oset ben ko ki fe I pe ko e ka tu Hanai ha mea o ko pehe o ko lahi taha ia whatumunga. Koe ki tāni no mai pe. Ha whai mea o ko pehe o whatupunga lahi ai ne mau e o tau kidney.
Koe, o kulahi ngahi, ai ngahi mea ki kidney he ko tau, koe ulahi ngahi toxic o kwa ko tau sino. Pea ko tau maa ki ngahi toxic.
Koe hau ha mea ke.
Ko hako au lau?
Koe hau he mea kai pe koe hau ha mea ke.
O hau he mea kai. O hau he mea kai pa hau. Pea kai whuke tau, ko tau inu ton ke tau inu I koe walu he te a. Koe mea kai, koe toxic o hau he mea kai whariria. Koe mea kai koe no tau kai. Tō mai ki konga mea kai te kai ke moa o te kai ke haka. Pa ke hanga mai ha microscope, strong microscope e tio ki ai. O kei ngau e pe me moa ia. Koe hanu ngau kei ngau e. Koe hormone. Koe hormone ko watu ke matua ai konga moa I mahina e tolu ke wha. Ka tolotonga I ton ke tupulere hono sino he ta.
Malo sonia ka ko wange whanga mare wha oskoni ka sina ko ngā ko panake e tau taimi ke tau wha osi. Sina, hoko atu. Unmute mai o telefonisina.
Ia, lava, sai. Ia. Sunia ko whamalo atu ki he u whare I whaofa mahu inga, pe whawhie marie, ke ohi ka mautolu kone e ka volunteer ke share ke tau kau tau lek kaka ko e whehui mahu inga inu ko loto pe ke o atu. Ka taki o kuiai hatou leka I siato o ku ke iloi, ke ohi he ku mauteu awa e pola kalamahi ke he I aokosi. Ako e tahaine ngā topic mahu inga apito ke au ke share manau tolu. Ka goloto pe ke o hanga o koe maweni me ya sunia laulile. Ka ha to leka sia to ku ke ilo, ha tala ofa ki ai pe ke te share ka nau tolu na tatawa na fe la tala no.
Koe motua ko to fohe ko ku to fohe.
Okay.
Eri ko to fohe ko father-in-law ia a whaiwhekau e tuini mo unga a fitu. O nau no whakataha pe aia koe tamai no mari. Ka kore sieri koe ni to whino lang toto helu.
Okay.
Ia to sieri helu tui pulotu. Ia kore sieri koe na pe mei whare loa
Koia. O wha pito ke share ka nau tolu ne whai ai tala noa. Pea ko ha umi wheho I tonga.
Koe ku hao mi whakakai.
Whakakai, okay.
Koe ku hao mi whakakai, pea o kulahi o ku whamiri hena. Ku hena e whanau, toko whanau unau I hena.
Okay.
Unau, pea koe ku whae, koe ku tamai, ko laulile. Pena e toko whahono whangatua whiwhine. Taha ko ako hao a tevita puroka mo mea.
Okay.
Taha u hao mea ere a soili pulu. Pe taha ko vea ai hao mea fono pe mo I holo peka. Nai toko wha ko ako vea ere pe mo asi. Taha u hao a soili pulu a asi. Ko tamai ne tangata pe.
Ko o fe fia o sunia na whatoko ni pe sina he mea a Luisa Laurile.
Yes. I know go sio ke last name. Ma hu inga o pito u hingo ke o mai he ko kawia ki he ke whawhiawhia ke atamai e kau tole ke reka. No sa ia ke recall back u original names. Pa ku kaweni I he u share ke share kanau tole.
Ko hingo ka nau ke ngaki ko sina.
Oh yeah.
Ko hingo pe ka sina ko na e mauhoa koe ki a halo ti puloka ki ho foi.
Oh, ila sina na mai fis whakataha mo sina. Na memio mai whakataha pe mo sina.
Heo nongo furtupu,
Iyo.
Ia, kako whine e ki o ku si ia sina. Ko whine e ki a koe ko tōkanga. Koe tamau a tōkanga.
Oia, oilo.
Ia sina.
Iyo, oilo. Iyo.
Malo, whaofa. O kai kia whaofa pito ko mau ai lelei me a koe ke whai ake ai share ke kau tōle kere kahe kuna o sa ia he whanongo ki ngoa me he tau motu. Ka kua o kātu me kau sinia, ka ofa pe ke toi aha tau toi talanoa a moiang he ka hau.
Koe, malo.
Ia.
O fatu.
Malo apito Uncle Sunia. O falahi
Malo.
O falahi finau.
Okay.
Malo Sunia.
Okay, o fatu.
O fatu.
Malo sina.
Okay.
Mahina, opo pea negala. oh